Every year, we see more than 70% of deaths attributable to chronic diseases, ordinary health problems such as diabetes, hypertension, and heart disease. And it's also here in Southeast Asia that more than half of deaths of children under 5 are because of premature births and babies afflicted with pneumonia and diarrhea in the first 4 weeks of their lives. So these are important health issues that we need to tackle. Joining me for this conversation are Zig Wronsky. He's the Vice Director of Nhi Dong 315. It's Vietnam's largest network of outpatient clinics specializing in pediatrics and maternity and women's health services. And Hendra Tjong, he's CEO of KlikDokter, a digital healthcare platform that serves more than 13 million Indonesians and growing. Zig, let me start with you. I mean, obviously we saw how COVID hit Southeast Asia hard and really early on. What are the lessons that we've learned from COVID, and how are we leveraging off of that?
Sure. So in Vietnam, actually, at the beginning of COVID, the government policy was to sequester all of the COVID patients in the hospitals. And this worked initially at the very beginning when the number of cases were low. But slowly with Delta and then suddenly with Omicron, it became there were too many cases for them. So the government changed the policy and changed the guidance, and they said, actually, the private clinics must open, must treat the COVID patients, and we must encourage more development of the private healthcare infrastructure, specifically around outpatient care, and specifically for treating patients without severe illness, right? Because otherwise they're just crowding the hospitals.
Yeah, that really paves the way for you guys. And Hendra, we also saw during COVID that KlikDokter also provided lots of services online as well as helping with medication.
Yeah, so I think maybe some of the lessons that we learned during COVID is, first, I think before COVID, I think a lot of people think that telemedicine or telehealth is not something that's important. Yeah. Even I think some of the people here will think that, why do we need telemedicine? Yeah, we can go to the doctors immediately. Yeah. But then during COVID, most of us cannot go out, and I think Indonesia has done a lot of tremendous things. We got a lot of huge support from the government institutions and also from the private institutions. Yeah. I think the other things that we learned during COVID is there's a need of a digital healthcare investment. Not only in telemedicine, e-pharmacy, but also in the other things here. Because we need to, especially in Indonesia, we need to make sure that people, even in the remote location, can receive access of good doctors and products. Yeah. I think we are lucky because as part of Kalbe Group, Kalbe is actually our parent company. When I think about Kalbe, right, it is the only company that does so many different things and have done it very successfully. Yeah. So as part of Kalbe has invested heavily in KlikDokter and our other platform, yeah. And so that we can bring end-to-end ecosystem that is complete in Indonesia.
Yeah, I mean, you're talking about serving 13 million so far through KlikDokter. You've got 3 apps. I wonder if you can tell us, I mean, how the telemedicine is really helping to democratize. You touched upon it a little bit. How is that democratizing healthcare and reaching the underserved?
Okay, I think in developing countries like Indonesia, right? I'm originally actually from Borneo here, so my island will be a capital city in the next coming years. So. It's very hard to find good doctors in the area. I think with in developing countries like Indonesia, in this remote location, there's almost impossible to find good doctors and even medicines here. People have to travel far away to Jakarta, maybe to Surabaya as well, to find good healthcare services or products. I think. Yeah, so that would be one of the things that we are doing actually.
Yeah, I mean, you guys in some ways operate very similar to kind of the Uber or Grab model for healthcare with KlikDokter and really giving access.
Yeah, I would just add that in addition to the doctor scarcity, the doctors are also not uniformly distributed. So if you're in Ho Chi Minh City, you might have access to a good doctor, but they might not be in your district. But if you don't live in the tier 1 cities, you really don't have access, period. So I think that's a situation where the telemedicine could be really useful.
And I wonder if an extension of that, if you can talk a little bit about how the demographic shifts that we're seeing all over, Southeast Asia and certainly in Vietnam, how that's creating growth for healthcare and certainly for your healthcare system.
Yeah, so there's actually a number of trends happening at the same time. There's obviously the development, so economic development. As people have more income, they demand more higher quality medical services. So there's that, but there's also urbanization. When people move to the city, they tend to seek out less informal healthcare treatments. So there's that. And also just the epidemiological transition as well, transitioning from infectious disease, tropical diseases to chronic care, chronic disease management. So over half of the Vietnam population are actually pre-diabetic. So there's a lot of demand in the pipeline for treatment of chronic disease, as well as cancer. There's a lot of cancer in the pipeline too. And the last thing I would mention is also the aging population. So the Southeast Asia countries have really good demographics compared to, say, the West, but they are actually some of the fastest aging populations too. Especially for elder care, we see that maybe in the next 10, 15 years being really important.
I think what's really great is both of your systems really are giving access to women and children. I wonder if you can talk a little bit about that and why that's so important for this region. I mean, are we seeing health outcomes improve with what you guys are offering right now?
So I think most of the people here don't know that we have 3 platforms. We have a KlikDokter, which is the telemedicine e-pharmacy. We also have another application called Halo Bumil, which is the #1 pregnancy app in Indonesia. We have served more than 3 million active users per month. And also we have a B2B order management system where pharmacy is connected directly to the principal or brands. Yeah. So with the pregnancy app that we have, I think all of us know that people who are looking to get a baby, right? Yeah, they like to talk to each other. Yeah, even during pregnancy, after pregnancy, they like to gain more information on how to get pregnant and then how to have a healthy children. Yeah, so that is actually something that we have been improving using our technology, and I think. In the next coming of future, right, there will be a lot more features that we will be integrating inside.
Right.
Yeah, I would add that in Vietnam, there is actually high levels of infant mortality as well as pregnancy complications. And just sort of speaking about the whole idea of sustainable development, it does seem like there are some trade-offs where, for instance, increasing levels of industry makes the air worse. The children present with a lot of upper respiratory disease. The water quality is also a big concern. So got to think about how to industrialize in a way that keeps people healthy at the same time.
I mean, also what we're talking about is, these models, I mean, serving pregnant women, serving children. I mean, these are, for your businesses, thankfully, a recession-proof business model, right?
Well, yeah, people always get sick, and the willingness to pay is quite high in this segment. But I think what we're doing is really solving access and quality, because what we do is we put a clinic in a densely populated residential area. So,
and usually that's usually far away from the city center.
Yes, exactly.
So in factories, near factories, and
kind of the same idea as Jakarta. Ho Chi Minh City has just sprawled, and so. If you live in a certain district, you might be extremely far from the hospital. So, yeah, we're trying to make it more convenient for the patients.
I think when you look at most of the healthcare business, right, even in Indonesia or even globally, most of the healthcare company actually, I think, focus more on curative. Yeah, I think what we want to achieve is we want to focus more on preventive, yeah, because as you know, most of the people actually are healthier compared to the sick people, yeah. Even though we know that chronic disease management is one of the concerns that every one of us have, yeah, because things are sugar level is one of the issue in everyone. Yeah.
Yeah. What about the obviously, we learned a lot of lessons. It seems like there's a lot of openness to telemedicine and technology. What are the challenges that you guys are facing, and how do we overcome them?
The challenges that, especially in Indonesia, I think number one is internet access. Not all the cities in Indonesia, or even the suburb in Indonesia, have a good internet access. I think number two is the number of good quality doctors that we have here, because to serve as many people that we can, right, we need a lot of doctors. I think one of the things that we are developing actually, hopefully with the support from the government, is we want to develop a chatbot to analyze early part of the disease before getting something serious. Currently, if you want to serve million of people in Indonesia, it's not enough with the number of the doctors that we have.
Yeah, I would just reiterate that the clinician shortage is the key issue. And the problem is that normally if you have a labor shortage, you can just increase wages and people will switch to that job. But it takes 7 to 10 years to train a doctor. So even if you decided today we need to double the number of doctors that we have, it would still take decades for them to come online. So what we're doing is really trying to maximize the productivity of the doctors that we do have. And so we do that through technology, where each doctor has an application that they can use to interact with the patient. But they're also supported with significant levels of human infrastructure. So each doctor will have one receptionist, one pharmacist, one guy to park the motorcycle, and one nurse. So a lot of the patient check-in and prescription filling and marketing to the patient can be done by other staff rather than just a doctor.
Yeah, I know in some models, like in Bangkok, there's also service where doctors and health assistants are actually getting out to patients, delivering medicines, but also doing some simple checkups. Is that also, when we talk about the Grab and Uber model, is that where we're headed as well?
That is actually e-pharmacy, right? In Indonesia, there's not much issue that we have in terms of the logistics, because as part of Kalbe, we have more than 25 distribution points where we can send medicines within, let's say, from 30 minutes up to a couple of hours in the same day.
I'd also mention that it's important, different ways you can use technology to empower even a less skilled clinician. So for instance, we built in our technology platform different ways to suggest the appropriate prescription and the appropriate dose, just to make that a lot more streamlined. So we're thinking about different models where maybe there's a nurse and then there's a doctor on telemedicine, for instance. So we can support, sometimes you need to have that person there physically to take the blood pressure or take samples or things like that. But if we can use technology to elevate the capabilities of clinicians that don't take as long to train as a doctor.
I think one thing that I can emphasize is there's a need of integrating telemedicine with the current technologies and new technologies, such as wearable device, medical device, home medical device, or hospital medical device, so that the doctors can do diagnosis directly from the hospital or from the clinics. I think this is what you call it, omni-channel service, right? I think those will be important when you have a lot of data like that, wearable device data, medical device data, and also, let's say, from genomic as well. All this data actually can be a good health scoring. And this health scoring actually will be quite important, let's say for insurance company or even for HR. Yeah. Let's say you go to the bank right now, right? There's a credit scoring system, yeah. But then, let's say in a couple of years later, if there's a health scoring system, that will be very important and very useful, because those data are real-time data.
Yeah, I think the data will be used specifically in the private sector for personalization, and then in the public sector for rationing. Because in some, sort of depending on the way that the health system is set up, sometimes even the public system don't have enough doses or inventories of different things.
Yeah. Now, Zig, you were one of the first investors in Nhi Dong 315. Talk to us about the investment climate for healthcare systems, and especially kind of startups like yours.
So I think there's a tremendous amount of demand coming online over the next several years. I think it's a multi-decade trend, not just a couple of years trend. And so I think you need to really be careful about making sure you're set up to participate in the benefits of those trends on the same time horizon. So I think we talk with some funds and they say, well, we'd like to exit in 4 years, but we see this trend not just in 4 years, but 10 years. So I think there's a lot of opportunity in primary care, as well as specialty hospitals and healthcare services. So.
Great. And Hendra, you guys are growing by leaps and bounds. 13 million and growing. Any thoughts about spinning off KlikDokter and that division off of Kalbe?
For Kalbe, actually, Kalbe like to grow organically. Kalbe has been exists in Indonesia for more than 55 years. So when I think about healthcare, right, it's a long-term investment. I know that I came actually from a finance background, investment background. Most of the investors, when you meet them, right, they'll ask for 4 or 5 years exit. But for healthcare, it's very different. Because it's a long-term it's a long-term game. But then when you do it in a right way, you can get the returns that you want significantly. I think for Kalbe, we have a plan to go IPO maybe in the next couple of years. So now we are growing significantly year by year.
Great. And would you spin off? After that IPO, is there a possibility or during that process to spin off KlikDokter as well?
Depends on what your question on spinning off. Spinning off can be diluted to up to 49%, right, or more than that. But for Kalbe, the idea of spinning off is not in our mind right now. But then for us, we want to contribute to the healthcare system in Indonesia as much as we can. So spinning off is not an idea right now.
All right. We've got a question here from the audience. What more could governments do to help companies like yours thrive and meet public health needs? Zig?
So one of the reasons that the public hospital system is extremely busy is because it's very difficult to obtain licenses to open up clinics. So there's lots of different licenses at lots of different jurisdictional levels. And so the government, obviously, they're the ones, handing out the stamps, so they're the ones who could make the stamps not required. So I think they could do some more to make it easier to open up assets.
What about here in Indonesia, Hendra?
I think the government in Indonesia has been very supporting. We even have one application in Indonesia called Peduli Lindungi. I think you guys have used it when you land in Indonesia, right, to check in or to check out. It has more than 100 million people in Indonesia have used it. I think the thing that we need help from the government is to get as many doctors as possible in Indonesia. I think if we don't have that, it will be difficult to scale up.
Great. I think that's a great thought to end on. Zig Wronsky and Hendra Tjong, thank you so much.
Thank you.
Thanks, guys.